Again for having me. My name is Leah Shipton. As Zoe said, I'm an assistant professor at the School of Public Policy at Simon Fraser University. I'm calling from the unceded territories of the Coast Salish people in what's now called Vancouver. And I'm a political scientist. I study global health governance, often, as Zoe said, at the intersection of global environmental politics. But I'm speaking with you today about work by my colleague and I, Lucia Vitali, on artificial intelligence in global health. I think, like many of you, we've been sort of watching the rise of discussions around AI in global health. We've seen it discussed as sort of the fourth industrial revolution. And we saw a lot of conversation about how the health and medical sector were sort of being portrayed as having a lot to gain from AI rolling out. And so, but as we were watching this discourse, just as a sort of motivation for this paper, we we started to sort of get curious around whether we were seeing this as another case of, techno-optimism in global health. The field of global health tends to rely on technological solutions to really complex political and social problems. And that's not to say that technology isn't part of those solutions, but often we see that they dominate the solutions that we have available. Partly because of the dominance of the biomedical model in global health that makes intervening at the individual level sort of more feasible, as well as market logic that tends to bring these technologies to market and that they can access markets in new markets, sorry. And so we were sort of curious around whether AI was being portrayed as a silver bullet to the health problems that we have found, an inability to solve over the last number of decades. Or even at the minimum, sort of a more tame understanding of techno-optimism is believing that technology's impact on the whole is or will be favorable. So we sort of were wading into this topic with a little bit of maybe skepticism. I will say, though, of course, I see a lot of benefits to the rollout of AI in global health, but we were wondering about this sort of repeated pattern of techno-optimism and how that was playing out with AI. And so for us, our starting point was, of course, acknowledging that technology is part of the solution to health problems, whether that be seatbelts that prevent, injuries and car crashes, whether that's, of course, vaccines and antibiotics or malaria bed nets. But I think given our background in public health, having concern that tunnel vision support for these technologies come at the expense of resourcing interventions that target more fundamental causes of ill health. And so we asked the question, what is avoided when global health prioritizes technological solutions to problems with sort of deep-seated political, economic, and commercial determinants? And we used AI as the latest technology being sort of rolled out in global health as our lens into answering this question. So this work is largely conceptual. We did a critical appraisal of a select literature. For us, critical appraisal is different than sort of a literature review where you are sort of synthesizing the themes in the literature. We really approach this with the aim to critique the literature constructively in order to reveal and challenge power structures that were underpinning the rise, the dynamics, and the sort of implications of AI rolling out in global health. And our main contribution is conceptual. We sort of come up with this term called the politics of avoidance through our engagement with this literature. And we define the politics of avoidance as the tendency for the field of global health to favor technological interventions as a way to avoid, intentionally or not, addressing the more contentious commercial, economic, and political determinants of health. So often it's very complicated to intervene at a more fundamental level. And so technological solutions allow maybe a more feasible way to intervene, and we don't have to confront those fundamental determinants head on. And we use our sort of analysis of the way that AI is being discussed in the literature to sort of reveal this politics of avoidance, which has probably sort of been intuitively seen by many people over the years in global health. Part of how we identify this is by looking at AI's expansion in global health as helping us see three trends. So the first is that it highlights areas of global health that have long been neglected in favor of vertical disease-specific interventions. Second, we're seeing that AI may reinforce this neglect in certain areas, this reinforcing of existing patterns and approaches in global health. But then we also see that there may be ways in which AI is expanding or disrupting some sort of long neglected building blocks in global health or disrupting existing patterns in global health. And we essentially break down these trends, what we call 7 areas of continuity and disruption, in sort of the bulk of the paper. And I'll aim to go through these with as much time or as briefly as possible. So there's 7 areas, the first of which is regulation of the private sector. And so this is a major area of continuity where our existing approaches to engaging these issues around the private sector's impact on health and regulating the private sector's impact of health are continuing in the era of AI. So the first continuity is that, of course, the private sector has huge impacts on health, both positive, but also some major risks involved. This is the case in other industries, and it is also the case with big tech companies and AI. There's risks associated with developing AI tools, with ensuring that they're accessible, as well as in using them. Some just sort of brief examples. Accessibility issues could come up as it relates to extracting data from populations to develop AI tools and then selling those tools developed back to the populations, potentially at out of reach prices, in a way that we've sort of similar to the access and benefits sharing issues we saw come up with the pandemic treaty. There's also potential risk that in low middle income countries, they might not have the purchasing power to develop or have AI tools developed for specific disease burdens in the global south, in the way that we've seen sort of neglected tropical diseases and market failures to produce products for those neglected tropical diseases. And then, of course, in the use of AI tools, there's a whole host of potential risks, the most extreme being in the wrong hands, they can sort of facilitate human rights abuses. But then there's very sort of specific risks for each AI tool. So David and colleagues out of University of Montreal, I believe, have done some really great work on AI detection tools for TB. And they essentially found that 15 out of the 17 models on the market use licensing models that tie usage to payment or payment to usage. So the more you use this AI tool, the more you pay, which sort of disincentivizes using the tool, and therefore in a resource constrained setting might lead to situations where TB diagnoses are going missed as a result. So as with any sort of private sector, there's a whole host of risks. But the second continuity that we were concerned about here is that there is a major regulatory gap in regulating the rise of big tech in AI, just as we have major regulatory gaps in other transnational companies or corporate conduct. And we've seen a trend in the AI space of relying on industry self-regulation or voluntary codes of conduct around the ethical use of AI, which is not, at least from our knowledge from other industries and other sectors, is not sufficient for safeguarding health. And so those are the two sort of first areas of continuity as it relates to the private sector. The second area of continuity relates to philanthropic power, where we're seeing, as in previous decades, philanthropic foundations play a key role in health, but they particularly play a key role in pushing for the use of technology to solve health problems, often by brokering the private sector's access to low middle income country markets. And there are some concerns here, at least based on previous patterns of major philanthropic foundations, around concerns for conflict of interest. So, for example, the Gates Foundation makes investments in vaccine companies in order to secure IP rights to those vaccines, which has, I think, as we all know, sort of consequences for access to those technologies. And we're sort of curious if we might see a similar pattern around AI tool development and IP ownership as it relates to philanthropic role in this space. We saw continuities in the way that investments and capacities to develop AI technologies or AI tools, as well as IP ownership, are concentrated in high-income countries, as well as in emerging economies like China and India. And in light of the COVID pandemic, where we saw that concentrated capacity to develop and manufacture vaccines created major issues in equitable accessibility to those products, we are wondering if the continued concentration of AI tool development in sort of a very narrow set of countries may also create the same accessibility challenges. And then a fourth area of continuity is around the dominance of the biomedical model and the use of AI. I think perhaps particularly in AI diagnostic tools that consider bodies out of context. They tend to apply Western understandings of disease that are standardized and quantified and assumed to apply universally across every body in a way that may discredit cultural understandings of disease and treatment, and potentially distort patient-clinician relationships if a clinician becomes sort of dependent on this very objective way of understanding disease. And also because AI tools have a sort of, they're sort of a black box. You don't really know why they came to the decision that they came to. The clinician can't necessarily sort of provide the why to the patient as to the outcome of the assessment of those tools. And then we have three areas of continuity and potential disruption where we could see the continuation of the politics of avoidance in the continuity, but there's potentially ways that this is getting disrupted with the rollout of AI. So the first is around the use of vertical versus horizontal interventions. So AI could theoretically and is piloted for both right now. So a potential continuity, though, is that we could over-rely on AI, and that could reinforce vertical interventions that have previously been ineffective or not wholly effective, right? So, for example, if you use AI diagnostic tools to diagnose TB, but you don't have a health system that can provide treatment to a patient, then we're creating a similar issues that we've had around, for example, test and treat in the HIV/AIDS space, right, where you could test for HIV/AIDS, but you did not necessarily have the treatment for it, right? And so these are sort of the barriers of vertical-based approaches. But there's areas of potential disruption for using AI as a high-tech tool, as a horizontal intervention, such as in patient triage. And this is unique because usually horizontal interventions are low-tech, whether that be community health workers or hand-washing practices instituted across a hospital, for example, or nutrition regimens that are paired with HIV treatment programs. And so this is one area of disruption, is that AI is scaled in a way that can be used as a horizontal intervention that would be quite unique for a high-tech tool, which is typically a vertical intervention. Another area of continuity and disruption is in health workforce shortages or crises. So I would say one of the most common ways that we see AI discussed is as a way to minimize the health workforce crisis by sort of providing either reducing administrative load in the health system or supporting physicians or health providers to diagnose, for example, or help with medical imaging, which would be especially important in rural or remote areas or in hospitals where there aren't specialist doctors, for example, or enough specialist doctors. Our concern, though, is that in this example, we see an area we see technology being used to sort of mask the political economic drivers of the health workforce crisis, whether that be the push factors, the factors that, lead health workers to leave the health system or migrate to other countries, as well as the pull factors in the case of health workforce migration that high-income countries especially sort of draw the health workforce from the low and middle-income countries. And so, again, this technology sort of, we're masking these fundamental drivers and the rollout of this technology as a solution to the health workforce crisis. And then there's, I think, sort of innumerable ways of disruption to the health workforce, whether that be driving under or unemployment in healthcare, the Uberization of healthcare, where physicians or other health providers perhaps start working on demand in the gig economy in the same way that food delivery drivers do, for example, or shifting job patterns. We saw a report that talked about how the rollout of AI might lead to a decline of health workers in the global south and an increase in med tech industry workers in the global north. And so, of course, all of this is still, I think, quite early stages. And so how this rolls out is to be determined. But those are some of the insights we learned in our appraisal. And then lastly, one of the bigger areas of potential disruption was around infrastructure. So because extracting data to develop AI tools and then using these AI tools require a significant amount of electricity as well as internet infrastructure, we are curious around whether the rollout of AI might see investments in these areas that were sort of previously neglected. Right, so during the COVID pandemic, we needed it was necessary to have strong electricity grid in order to have mRNA vaccines distributed to maintain the ultra cold chain. So the sort of infrastructure barriers have long been a concern as it relates to facilitating healthcare service delivery. But this has been an area that's been sort of neglected or in favor, we would sort of argue, of technological interventions. But because this technology requires this infrastructure, um, we're curious if we might see progress here. And Facebook's free basic application is an example here where they have provided basic internet in 22 African countries where there is um, uh, less internet access. And their motive here is to essentially create incentives for users to pay for more data or for more access to the internet, but then also to collect data on the population. So they've sort of created some semblance of an infrastructure to facilitate data extraction for their company, and we're curious if similar dynamics might play out as we continue to see AI expand. I'm happy to reflect on the risks. My background is in the regulation of the mining sector, and so we took some lessons around how the mining sector carries itself in these areas. And I'm happy to reflect on the risks later on. So very briefly, in summary, um, we found that some of the literature reviewed confronts the politics of avoidance head on. This is particularly common in the literature that talks about that calls for greater regulation of the role of the private sector in this space. I think more often, though, we found that the literature discusses, health system capacity, and it discusses the barriers to implementing AI effectively and equitably and trying to problem solve those barriers, which is important to do, but it doesn't necessarily sort of confront the upstream causes of those problems. And that's the sort of avoidance that we were noticing. And again, that's not to say that problem solving those downstream interventions isn't important. It, of course, is. But I think this intervention for us was about sort of drawing the gaze up a little bit to look at the deeper causes of these health problems to make sure we don't get too stuck in sort of techno-optimistic ideas of solving health problems with AI. So I'll leave it here. It was a joy to be able to re-engage with this paper after a year. So thank you, Zoe, for the invitation. I think many of you are more experts in AI than I am even. So I'd be appreciative. Yeah, I wonder if any of this resonated and curious to hear your thoughts.